organizers for this opportunity to present our institutional data from AIIMS New Delhi. And I'm Dr. Atul Batra. I'm Associate Professor, not Professor in Medical Oncology at AIIMS New Delhi. So this is basically a single center data from the IRCH, retrospective chart review basically, of the patients who were diagnosed with triple negative breast cancer and treated with neoadjuvant chemotherapy during the period of January 2015 to December 2020. Now, most of the patients actually belong to the later half after the publication and of CreateX study. More patients have been included in the neoadjuvant treatment policy. So our standard treatment regimen is EC, which includes epirubicin 90 milligram per meter square and cyclophosphamide, followed by taxane, either conventional 3-weekly or a dose-dense 2-weekly regimen. The outcomes that we looked at in this study was pathological CR, 3 years disease-free survival, and overall survival. So basically, we had 512 patients with triple negative breast cancer, of which 440 were non-metastatic, and around 63.4% received neoadjuvant chemotherapy. Now, more and more patients are receiving neoadjuvant chemotherapy. Anyone with more than 2 centimeters of a triple negative tumor goes on to receive a neoadjuvant chemotherapy. The median age was 43 years with an interquartile range of 39 to 47 years. If you look at closely, around a quarter of patients were less than 35 years. That represents how young our patients are. And more than 60 years were less than 10%. 60% were premenopausal, and around 14% patients had a family history of any malignancy. If you look at the T-state distribution, this will be different from the previous presentations. Our institute basically caters to the area of UP, Bihar, and we see a lot of patients presenting in the late disease, locally advanced disease. So around more than 50% of the patients actually had T4 disease, and only 21% of the patients were actually node negative. And as we can look from here, stage 3 were almost 3/4, while stage 2 were 25% roughly. Now, the treatment characteristics, anthracycline and taxane was the most common regimen, 92%. Some patients did receive carboplatin, but that was a minority. And dose-dense regimen was followed in roughly 1/3 of the patients. Breast conservation surgery was done in around 20% of the patients, and radiotherapy was given in around 58% of the patients. So if you look at the overall response rate with neoadjuvant chemotherapy, it was around 75.5% with a pathological CR rate of 30.6%. We did a multivariate logistic regression analysis to look at the predictors of CR, and we found that there was only one factor which was significant amongst the factors that we looked at, which was stage 2 disease. Actually, stage 3 disease had a lower chance of achieving a path CR. So here the odds ratio was 0.27 as compared to stage 2. The other factors actually did not have any effect on achievement of pathological CR. So probably that also explains the lower proportion of patients who achieved pathological CR as compared to other studies. We had a larger proportion of patients who were stage 3, and stage 3 had a lower chance of pathological CR. Coming to the second outcome, that is disease-free survival, with a median follow-up of 3.4 years. There were 69 events. Most of the events were distant, around roughly 2/3 of the events. If you look at the 3-year disease-free survival, it was 62.4% for the overall population. And now if we look at those who achieved a pathological CR, it was actually almost double as compared to those who did not achieve a pathological CR. So it was 87.8% versus 47.0%, which was statistically significant. Now, we also looked at we performed a Cox regression analysis to look at the factors that affected the disease-free survival. Of the factors that we looked at, we found that age less than 35 years, stage 3, and non-achievement of a path CR were associated with a worse outcome with regards to the disease-free survival. So younger patients, stage 3 patients, and patients who did not achieve a pathological CR had a worse disease-free survival. Look at the overall survival. The 3-year overall survival was 77.2% overall. This was remarkably high, again, 93.9% in those with pathological CR as compared to 71.7% with those who did not achieve a pathological complete response. Again, statistically significant. We also looked at the same factors with the overall survival. And again, all those three factors were found to be significant. Younger patients, independent of other factors, stage 3 disease and non-achievement of PATCR had worse outcome with respect to overall survival as well. So thank you for the opportunity to present this data from our institutes, and I acknowledge all our patients at IRCH, AIMS, and our breast oncology team at the All India Institute of Medical Sciences. Thank you.